activities.
Okay. And you have ever since launched the Epuka Uchafu campaign. And what does this entail, and what strategies are you putting in place to achieve that? Because it seems a very high set goal that which is a must achieve for you.
One of the key components of primary health care is prevention. Prevention, promotion. And as a country, we are moving towards a more looking in terms of diseases, prevention and promotion. So we would really want to encourage the people and to push the idea that before you go to hospital, if it is something that can be prevented, then let us handle these issues at the bottom of the pyramid. Let us handle them at our household. The rolling out of 100,000 community health promoters. The idea was basically to ensure that we are able to screen ourselves earlier. We are able to educate ourselves in terms of the issues that we need to do to prevent diseases. One key thing, many a times germs will touch surfaces, where children will go to play, and when they come back, probably if they don't clean their hands, they can get cholera out of the dirt. You know, issues like vector-borne diseases, malaria, you know, which is preventable by simply just sleeping under a mosquito net and possibly draining the water around your compound, ensuring that you cut the long grass around your compound. So the concept around Epuka Uchafu, Afya Nyumbani, is basically to know that we are taking care of our personal hygiene. Personal hygiene, wash your hands. Remind the children to go with handkerchiefs in school. You know, clean their bodies on a daily basis. Secondly, environmental hygiene. Environmental hygiene in terms of clearing our bushes, sweeping our compound, you know, planting more trees. And when you're told to plant trees, it doesn't matter. It doesn't mean that you're being forced to plant trees that will produce timber. You can also plant a fruit tree. Okay. And finally, water and sanitation. About 15 counties in this country are still flagged up for open defecation. You know, as late as this 2024, 15 counties that people still do not have toilets. And it is the high time we went all out and trained them and told them that causes of some of these diseases will come from that. Feces being swept away by water and going to our clean water. And once we take it, then you become sick. So really, Epuka Uchafu, Afya Nyumbani is to ensure that at the bottom of the pyramid, we know the areas that we need to touch to reduce the burden of diseases and equally to reduce the queues in our hospitals.
And this is meant to, of course, not to overburden the healthcare system and inundate the capacity. But then the resources to do this, I mean, is it adequate given the fiscal deficit and the constraints that at the moment is a reality in the country? What's the deployment of the resources for this campaign?
Really, part of it can even be non-monetary innovation. You know, when you tell somebody to sweep their home, you're simply just telling them you can even make your broom even at home and sweep. However, we have also approached a lot of partners to come on board. So, because this is a collective responsibility. It is not an MOH issue or even a personal issue. It's a collective responsibility from financial institutions, the media. You're part and parcel of us to help us pass the risk communication down to the bottom of the pyramid, development partners, NGOs, and everybody else, private sector. So it is not just an MOH issue, and the funds will be pulled together from the different quarters to ensure that we activate the same. We already have a few partners on board, and that is why we were able to do a mini launch So we will be having a bigger launch coming to ensure we sensitize the people as much as possible.
And this is a particular issue that you have kick-started with. Are there then others in the loop in terms of other campaigns that are meant, because you have said this is just meant to help our healthcare system, and clearly at times the capacity may be a concern, and to not overwhelm it, such campaigns are very key. What are the others that could be in the loop, or plans of the Ministry of Health that you are spearheading, or the ministry?
Of course, we are not starting. We are not reinventing the wheel. Any other smaller campaigns will plug in. You know, if it is an issue of wash, we don't have to do away with it so that we can deal with the campaign. It will be part and parcel. Campaigns to do with community health promoters, activities on the ground. Remember, our community health promoters have a big task to ensure that they register people. Already we have about 7.6 households that have been registered by our community health promoters. And their main role basically is to take their blood pressure, check their blood sugar, remind mothers and caregivers to take their children for injection, you know, and equally ensuring that they cascade down, educate the masses on good practices around cleanliness of our households. So really, other campaigns or other smaller campaigns, we will pull them together so that it becomes one big campaign that can help the people, and everybody can be part and parcel of that.
And there's the aspect of the community health promoters, the families themselves.
Yes.
And in this regard, then, is it a countrywide approach, and how many counties have you so far covered with this campaign? So
far, we just did the first campaign last week, which is the West Pokot County. This month, this coming month, we will be slotting in another county. So every month, we will be having a county where we will be activating this. Yes. In terms of the prevalence, are there counties that you prioritize over the others because of maybe? Of course, if you look at some of the diseases, especially like malaria, where the prevalence of malaria in the country is about 6%. But if you look at a county like Busia, which has about 39%, so we already have another campaign for malaria. Distribution of the long-lasting insecticidal nets. Therefore, we will give a prominence to some of those counties where, if it is an issue of malaria, then we will go to the counties where there is high prevalence, like Busia County. Of course, we have about 22 counties that we are distributing the long-lasting insecticidal nets. About 15 million nets will be distributed. We've already done 18 counties so far. So, together with this, it's still part of Epuka Uchafu, Afya Nyumbani. By the time you're distributing that net, you will have spoken to the members of that household on how to keep themselves clean, because you can have the net and fail to clean it. Therefore, it is part and parcel of the Epuka Uchafu. And this brings in the very key role that community health promoters play, is it, towards the universal health care coverage that yesterday during the handover the new minister said that the course is to kickstart it by the 1st of October. Yes. I want to give you data of basically what the community health promoters have been able to do. Already in the country, they have, on their electronic community health information system, they have been able to register 7.6 million households. In a normal household in Kenya, we have about 5 people. So this translates to about 7 times 5, about 30 million people who have been registered. And out of these, the CHPs have been able to test 5.3 million people for diabetes, and they have referred 3 million of them to the health facilities for further assessment. And they have been able to test, they have been able to check on maternal health 206,000 mothers. You know, women who have gotten pregnant, they are in their houses and they have not gone for prenatal care.
Okay.
So they have been referred, 86,000 of them have been referred to the health facilities for further assessment. So this is work ongoing. And even when we start rolling out SHIF, the community health promoters will be of much help. As we are rolling out SHIF, they will be able to register Kenyans for social health insurance. Again, they are the same people we have used to make sure that we distribute nets across the country in the 22 counties which have high prevalence for malaria. And we have been able to streamline this, ensuring that they are letting people to register so that they can get the net. And when it comes to distribution, they have been able to distribute the same.
Thank you. And one final question. We recently covered a very disturbing story about food preparation in Nairobi, and I'm sure you have watched that. The county government of Nairobi, Chief Officer of Health, Mr. Mosiria, was also there in that inspection exercise which happened in the city, and the conditions were really, really, really dangerous and not so nice for the eyes, and especially what people consume as street food. Do you also set to target such areas where food is prepared?
Well, yes, we do. Remember, health is a devolved function, and the role of the national government is policy and training. Therefore, our collaboration with the county government is very vital in terms of handling such issues. And I know we are in communication with Nairobi County to ensure we tighten some of the rules, regulations, and policies that are around that. Then, of course, enforcement in terms of closing some of those kiosks will be a big role, but we have to take it up. So this conversation has to continue, and it is not just Nairobi County, it's across the country, because foodborne diseases has become the order of the day because of scrapless food kiosks that have been opened by people who are not licensed. And licensing is a long list. It requires many stakeholders together. It is not just an MOH affair. It will require also environment issues and many other on board.
Madam Principal Secretary, thank you for your time and giving us an assessment, an upbeat assessment of the situation across the country. Many thanks for your presence here.
I want to ask the members of the public to remain calm, because the situation of Mpox really has been taken care of, and should there be any that is emerging, it is going to be treated.
Thank you.
And also, I want to request the members of the public to equally register for social health insurance. Star 147 #. It's as simple as that. We do not want people to have a challenge when there is Mpox and you do not have insurance to treat you.
Thank you so much, Madam Principal Secretary. Mary Muthoni is the Principal Secretary, the State Department for Public Health and Professional Standards. And many thanks for your time as well, for keeping us company here on the broadcast. Since morning at 6 a.m., the hashtag is Citizen Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikadir. Up next is DJ Gigi, who appears once in every month. So mathematically, you can do that how many times he appears in a year. But on Sundays, he is on Bambika here on Citizen Television, and he destines himself as a man of God, and he'll be playing a long playlist of gospel music on this special edition that will be coming up shortly here on the broadcast, where he will be giving you, keeping you with the word of God here on the broadcast. And many thanks for keeping us company. We'll see you next week here on the broadcast at the same time. Till then, good morning and have a lovely weekend.
Good morning.